So, what is the philosophy behind upper cervical care, or why do you approach healing the way that you do?
Well, I approach upper cervical chiropractic care as the primary method of which I am able to help people through chiropractic for the express purpose that it is the most important level of the spine. The craniocervical junction or the upper cervical spine is a balancing spot for the rest of the spine to be able to function at its best. But in addition, over the last 5 years, we've learned the importance of how much is involved with the upper cervical spine having an impact on brain health, which is certainly the most important thing that we can do.
How have you seen upper cervical care improve or advance throughout your career?
Well, I've been in practice over 20 years, and I knew virtually very little about the upper cervical spine when I started practice. But through personal experience and through clinical correlations, I found that that was an area of the spine that I just wasn't able to help people with very well. And I could tell that there were persistent problems in a portion of my patients. So the more I identified that, the more I searched for alternatives or ways of being able to better correct that, I found out that I needed to have specific training in upper cervical chiropractic. So in the last 20 years, it's changed an awful lot for me personally. Thankfully, we've had pioneers that have been working with the upper cervical spine for upwards of 30 or 40 years. And as a result of that, chiropractic, upper cervical chiropractic healthcare is something that has continued to advance. But the other major change is that of advanced imaging technology. We've known for many years that the upper cervical spine has an effect on immune system health, on brain health. We help people with fatigue, brain fog, sinus allergy problems, post-concussion syndrome. And we know that it works, but the advanced imaging allows us to validate this scientifically, that things are occurring in there and that changes are happening that do indeed impact brain flow or brainstem pressure and functions of the brain.
And how have you personally changed through the advanced studies of the Diplomate program and other continuing education?
Okay. Well, the advanced studies of the Diplomate program has been very much challenging to me. Over the last 3 years, I've been exposed to different upper cervical techniques, and though we share an awful lot as far as our approach, there are some differences that have helped me to be a much more well-rounded upper cervical chiropractor, to be able to understand the differences and how to be able to expand my services, to be able to work interdisciplinary with other professionals, and certainly to understand the value and the benefit of what we do on a regular basis to help patients.
What kind of quality of care could a person expect from a Diplomate in chiropractic craniocervical junction procedures?
Well, a patient can expect an awful lot more from a Diplomate of the craniocervical junction procedures. Number one, we have the latest in training and technology. We have the most well-rounded education when it comes to being able to correlate the specific problems that a patient may enter with and be able to go much further beyond what might certainly be expected of the average chiropractor, or even when somebody is specifically seeking out an upper cervical chiropractor.
What kind of conditions can be understood, cared for, and properly managed by a Diplomate that would not normally be a chiropractic candidate?
Well, there's a number of conditions that can be helped with upper cervical chiropractic that is normally not considered to be a chiropractic problem. One would be post-concussion syndrome, where we can manage those type of symptoms and problems, those that have vertigo or dizziness, those that have severe forms of headaches, migraine, cluster, tension, certainly those that have neurodegenerative problems such as MS or Parkinson's and the like. those are conditions that can be managed with upper cervical chiropractic care.